Hello, I'm Gerardo Jacopino, neurosurgeon from the University of Palermo in Sicily. I am so grateful and proud for your invitation at the 47th Congresso Argentino de Neurochirurgia. Thanks to Professor Baccanelli for inviting me. As you see, I added a little subtitle to my presentation. This is because I'm going to present you our 5 years experience and 4 years follow-up in using high-intensity focused ultrasound guided by a 1.5 Tesla MR machine in order to shape non-invasively a lesion into the thalamus and treat movement disorders such as tremor. Movement is freedom, and in some way I think that your traditional dance, tango, learns us so much about movement related to freedom. But let's go on. Let me declare my disclosures. In his monography, James Parkinson, more than 200 years ago, described a group of 6 patients affected by movement disorders. He stated that those patients were each suffering by a disease of a nature highly afflictive, which the unhappy sufferer has considered an evil from the domination of which he had no prospect of escape. That was an impressive description. He was not talking about tremor, bradykinesia, or rigidity, but about the imprisonment, about lack of freedom, the worst prison ever made, our own body. But in the same book he introduced the evidence that a lesion to the brain, as an ischemic lesion, may cure tremor. He described this presenting his patient number 4, who suffered an ischemia and stopped tremoring on the same limb. For many decades, lesioning was the main functional neurosurgical treatment for tremor. It was abandoned with the introduction of deep brain stimulation, so lesioning was thought definitely passed away. But even DBS, which is actually the state-of-art treatment for advanced Parkinson's disease and other movement disorders, can fail, and we have already learned that. There may be several kinds of complications, as late migration of electrodes, as we published some years ago. Given the ancestral dismay aroused by brain surgery, is it possible today a functional neurosurgery that restores the lost nervous function, avoiding the surgical approach to the cerebral shrine? In Palermo, we had the fortunate opportunity to have a new machine 5 years ago. Then we started our experience of lesioning the brain again after the stopping provocated by the introduction of deep brain stimulation. This new technology seemed very promising for several reasons. The main idea was to deliver into the brain, in a non-invasive way, harmless ultrasound waves. The focusing may cause a manipulation of the nervous structures, consisting in lesioning. Archimedes, who lived in Sicily more than 2000 years ago, was tributed to use the focusing technique to destroy the Roman naval army during the Punic War. By the truth, in the modern era, the idea of the efficacy of using ultrasound in order to lesioning the brain was well known and used in an experimental way since the 60s of the 20th century. But at that time, technology did not permit ultrasound waves to penetrate the bone of the skull, so craniectomies had to be performed. Since January 2015, it's active in our university hospital in Palermo, a device for transcranial surgery treatments by high-intensity focused ultrasound waves. This unique machine delivers focused ultrasound waves, which are guided by a 1.5 Tesla magnetic resonance machine. To make all this work, the most important word is teamwork, inter and interdisciplinary competence. You can't do the job alone, just as tango. You can't dance alone. The device uses high-intensity ultrasounds focused on a volume target calculated by stereotactic method and guided by magnetic resonance. This permits a real-time evaluation of the tissue effects through sequential imaging and exact temperature monitoring through thermometry based on frequency variations of protonic resonance. In this way, we may choose the ultrasound power delivery in order to obtain a step-by-step temperature increase, and so have a real-time operative feedback. At less than 45 Celsius degrees, we have the morphological confirmation of the site of the target. At less than 50, we have a physiological effect, and we may evaluate tremor suppression or eventually collateral effects that are reversible. At more than 55, we have a real lesion with a definitive therapeutical effect. Actually, in Italy, we are certified to treat few pathologies and reach some targets. Here we can see some pictures of the preparation before the patient enters the MR machine. The head of the patient is accurately shaped and blocked in the stereotactic frame. A silicone membrane is put on the head of the patient. The patient is positioned in the ultrasound helmet, which is filled with cold decassed water circulating in order to obtain an adequate acoustical window. Then after the patient is slided in the MR machine and the treatment will be started. The procedure is done as a normal MR examination in the MR suite. Attention, the red light indicates the ultrasounds are being delivered. As temperature reaches 55 Celsius degrees, tremor stops immediately. Treatment can be interrupted in any moment by a security button that may be activated by the operator or by the patient himself. As sonication sessions are going on, MR scans are performed, making more and more evident the shaping of the lesion. We have published the data in a first group of patients treated in the first 2 years. It has to be outlined that at that time we have the unique device that uses a normal 1.5 Tesla MR machine. The results we obtained are comparable to the other series where a 3 Tesla machine was used. This may be a useful information for the economic impact of the issue. From January 2015 to November 2019, 73 patients from different Italian regions were enrolled, 61 suffering from drug-resistant essential tremor and 9 suffering from tremorigenic Parkinson's disease, 1 from thalamic pain and 2 from tremors due to multiple sclerosis. Of these patients, 67 completed the treatment, while in 6 it was discontinued prematurely. Treated patient had a BIM thalamotomy using an MR-guided focused ultrasound. The Fan-Tolosa Marine Tremor Rating Scale and the QUEST questionnaire were used to assess the severity of tremor and disability in patients suffering essential tremor, while patients with Parkinson's disease were evaluated by the third section of the UPDRS scale. These are our patients enrolled. Here we can see one of our first patients. He suffered unilateral severe tremor in his right limb and asked to don't have DBS because he worked in an electrical factory. So it was supposed that there may be many magnetic interferences that could act on the electrode device. As you can see here, there is a very severe right limb tremor, and he couldn't just put the pen on the paper to write anything. As soon as he terminated the procedure, he could immediately return to write his name quite correctly. As you can see here also, this lady improved on her right upper limb after treatment. The graphic test improves significantly after treatment. In this graph, we can see a general improvement of tremor in almost all patients, and for those patients which we have a longer follow-up, the improvement persists. Our results confirm that there is an immediate 70% amelioration of tremor after treatment in the contralateral limb. Here we can see the position of the lesion some months after treatment. The complications are quite mild after treatment in our series, and generally they fade away after 1 week. The most serious complication was a foot dystonia in a Parkinsonian patient. Let's talk a little about the impact of this technology on medicine. In these last years, as you can see, the FUS technology is widely used in medicine, and the brain indication represents only 1% of the cumulative treatments by indication. Actually, it's estimated that worldwide there have been around 2,000 treatments for brain diseases. The main indication in the neurological field is actually essential tremor, and in a less fashion other movement disorders, but there are many promising indications that are actually on ongoing trials, as obsessive compulsive disorders, brain tumors, neuropathic pain, etc. The publications are fastly growing every year in this field, which means that a lot of scientific interest is driving and pushing this technology, which is actually one of the most promising. The focused ultrasound neurosites are fastly spreading around the world, and actually this map isn't precisely updated. For example, in the south of America, a neurosite is working in Santiago, in Chile. To come to the end, this is what our first patients told us after treatment. He was a 75-year-old patient suffering since long time of essential tremor. He said, "I would never have undergone a classic surgery with drill and probes. Thanks to you, in this way, I was free from the embarrassment of my trembling and from the prison of my illness." He was escaping the spell, the malediction, which was imprisoning his body and his soul, because movement is freedom, just as I have learned about tango. Here we can see an image of spiritual freedom But let me go back to more than a century ago, when in your nation many people came from Europe, a lot from Italy. Many of those were escaping from an imprisoning condition, which was poverty. Somebody says that tango started by those people that were searching redemption. The tango dance helps you to redempt, to look at freedom. Personally, I have experienced that after a very hard period of my life, when my wife died by cancer. I met these two guys who are my tango mentors and taught me the value of movement by introducing me to the basics of tango. They are Argentinian. It was a spiritual and a physical journey for me. Attention, I don't have a dancing attitude, since I never danced before in my life, any kind of dance. That's where I met my second wife after years of bitterness. Here is me and Giovanna, my second wife, dancing tango. That's why the subtitle, The Tango Lesson Towards Freedom. Movement is freedom, so we do not cure only tremor. The first and last image is this little girl who seems that cannot move because she's on a wheelchair, but looking at the sun, even she can feel freedom. This is another lesson for all of us about movement and freedom. This lesson is given to me every day by that little girl, who is Roberta, my daughter. Thank you for letting me share my professional and personal experience, and thank you, Argentina.